I can guarantee you that any of you here who've had chronic illness of any kind, you're going to recognize yourself in this talk completely and 100%. And you're going to wonder, why didn't anybody say this to me before? Because in the West, when I say the West, I mean the dominant Western culture, unlike Aboriginal cultures, unlike the traditional medicines of China or India or native traditions around the world, we separate the mind from the body. So we treat only the body, unless you have mental illness, in which case we still separate the mind from the body. And the other thing we separate is the individual from the environment. As I said to you last night, those of you that were there, you can't separate people from their environment. People are shaped by the environment. And in lifelong, in interaction with the environment is how human beings live. Now let me give you 3 examples of that. Why you can't separate people from the environment.
Stuck in a cycle of stress and illness? Dr. Gabor Maté cracks the code on chronic conditions, revealing how your behavior might be the missing piece to your health puzzle. Watch now and discover how to break free and reclaim your well-being. But before we proceed, please don't forget to like and subscribe to Inside Serene, your mental fitness channel.
My work as a family physician, which I did for 20 years, and 7 of those years I was also medical coordinator of the palliative care unit at Vancouver Hospital, looking after terminally ill people, people dying of cancer, neurological diseases, and so on. And what I found in all those years, learned all those years, what I had not been taught in medical school, is that who gets sick and who doesn't is not accidental. That although we tend to think on cancer and multiple sclerosis, which I mentioned last night, or rheumatoid arthritis, or chronic asthma, psoriasis, eczema, colitis, Crohn's disease, any number of chronic illnesses is somehow random events that unfortunately and mysteriously strike a person. And occasionally we think that we can explain the cause by the lifestyle of the individual, like smoking, of course, and its connection to lung cancer. But other than that, we think that these diseases are either mysterious and unexplainable misfortunes, or they are caused by people's genes. And what I found that quite on the contrary, that who got sick and who didn't wasn't random, and that there were certain identifiable patterns, certain personality traits and behavior, ways of behaving that people unwittingly, without knowing it, unintentionally, but they brought the disease on themselves. And that wasn't their fault. They didn't know what they were doing, as you will see. But since we're talking about caregivers, and let me tell you one little fact that, and since the book was published, which is about 10 years ago now, I think, or 9 years ago, there's been so much more evidence tending in the same direction. One bit of evidence about caregivers is that there's a structure at the end of our DNA, our chromosomes. Chromosomes is the strands where our DNA is located in our cells, in the nucleus of our cells. And these strands of chromosomes have at the end a structure called a telomere. A telomere is like the glue at the end of my shoelace to keep the strands from fraying, to keep it together. When we're born, our telomeres are a certain length. And as we get older, gradually, they shorten as we age. And until at the end of our life, they become unraveled, at which point so do we.
At this stage, Dr. Gabor explained our DNA blueprint. Imagine a recipe book containing all the instructions for building and maintaining your body. This recipe book is your DNA. DNA is a long, twisted molecule that carries the genetic information you inherit from your parents. Chromosomes, the packaging. This long DNA molecule wouldn't fit neatly inside your cells, so it's packaged into structures called chromosomes. Imagine the recipe book is carefully folded and tucked away on a shelf. Chromosomes are like the shelves in the recipe book analogy. They keep the DNA organized and protected. Telomeres, the protective caps. The ends of chromosomes have special caps called telomeres. These telomeres are like the plastic tips on shoelaces that prevent fraying. They protect the valuable genetic information stored within the chromosomes. Telomeres and aging. With every cell division, telomeres become a little shorter. This shortening is like the natural wear and tear on the shoelace tips. As we age, our telomeres become progressively shorter. Stress and telomere. Shortening. Dr. Mate might have mentioned that chronic stress can accelerate telomere shortening. Imagine the shoelace tips fraying much faster if you constantly yank on the laces. Chronic stress might put a similar strain on your telomeres. The importance. Shorter telomeres are associated with an increased risk of various health problems. Key points. Telomeres are protective caps on chromosomes. They shorten with age and might shorten faster under chronic stress. Short telomeres are linked to an increased risk of health problems. Note: the exact mechanisms by which stress shortens telomeres are still being researched.
Her doctor's name is Harold. Her husband's name is Hai. And Donna is the second wife. The first wife died of breast cancer. Now Donna, the second wife, is diagnosed with it. And so Donna writes, Harold tells me that the lump is small and most assuredly not in my lymph nodes, unlike that of Hai's first wife, whose cancers had spread everywhere by the time they found it. You're not going to die, he reassures me. But I'm worried about Hai, I say. I won't have the strength to support him. Now, what do you notice? Her first and automatic thought is, how can I support my husband emotionally as I'm dealing with a potentially fatal illness? So this compulsive and automatic concern for the needs of others while ignoring your own is a major risk factor for chronic illness. The other clippings I will read you are obituaries, all from the Globe and Mail. Obituaries are fascinating because they tell us not only about the person who died, but also about what we as a society value in other people. And often what we value in other people is exactly what kills them in the first place. You heard the expression, the good die young? They do. And there's reasons for it. A lot of you are heaving a sigh of relief. Okay, I don't have to worry about myself then, you're saying so. But listen to these obituaries. This one is a doctor who died age 55. And I'm talking here about people who died before their time. This guy dies at age 55.
Donna's story likely revolved around her experience as a caregiver for a chronically ill child. This role presumably involved a high level of ongoing stress. Connecting the dots. Dr. Gabor Maté might have used Donna's story to demonstrate the impact of chronic stress on telomeres. Here's the connection. Chronic caregiving. Stress. Donna's role as a caregiver likely placed her under chronic stress for an extended period. Accelerated telomere shortening. Dr. Gabor Maté might have suggested that Donna's telomeres might have shortened faster due to the chronic stress of caregiving. This could have been based on studies that show a link between stress and telomere shortening. Cellular aging. Shorter telomeres are associated with cellular aging, which might increase susceptibility to various health problems. Overall, Dr. Gabor Maté likely used Donna's story as a relatable example of how chronic stress, in this case caregiving stress, could potentially accelerate cellular aging at the telomere level. It's important to note that this is likely an anecdotal example used to illustrate a concept. There might not have been a direct comparison of Donna's telomere length to a control group. While stress can impact telomere length, it's not the sole factor. Genetics and other lifestyle factors also play a role. The takeaway? Dr. Gabor Maté's point is that chronic stress can have a significant impact on our health. Donna's story serves as a reminder of the potential cellular consequences of chronic stress.
It actually suppresses the immune system for reasons I will tell you later. So there's basically 3 ways of dealing with anger. One is to repress it, like this woman did. So these are the people that are always nice. You know, they're always nice. I worry about really nice people. The other way is to give in to it and to act it out, to go into rages. That's also unhealthy. The repression of anger leads to autoimmune disease and cancer. When you're raging all the time, that increases your risk of heart disease and strokes. So in the aftermath, the studies have shown that in the aftermath of a rage episode, your risk of a heart attack doubles for the next 2 hours. Then there's the healthy expression of anger, or the healthy processing of anger, which most of us don't know how to do. We either do the one or we do the other. I'll talk to you about healthy anger later. But how do we deal with anger has a crucial effect on our health. And this guy writes, you know, she had no ego. She just blended in with the environment in an unassuming manner. And this is supposed to be a good thing. Now, my wife's name is Ray, and she's an artist, and it's one of her paintings that provided the detail here on the cover and the color scheme for the cover for this book. And sometimes I say to Ray, you know, we've been married 42 years. I go, well, why can't you blend in with the environment in an unassuming manner? But Ray has done her psychological work, and she's read my book, and she's also seen the studies. You know, there was a study just 4 or 5 years ago presented at a major medical conference that looked at 1,700 women over a 10-year period. And over a 10-year period, out of these women, those who were unhappily married and suppressed their feelings were 4 times as likely to die as those.
Dr. Gabor Maté highlights the connection between suppressing emotions and chronic stress. Here's a breakdown of why this might be the case, using relatable examples. The body's stress response. Imagine your body has a built-in alarm system. When you encounter a threat, this alarm triggers a stress response, releasing hormones like cortisol to prepare you to fight or flee. Once the threat is gone, the alarm should deactivate, and your body should return to a relaxed state. Suppression versus expression. Expressing emotions. When you experience emotions like anger, sadness, or fear, a natural response is to express them in a healthy way. Talking to a friend, journaling, or engaging in physical activity can help you release the pent-up energy associated with these emotions. This allows your body's stress response to deactivate and return to a balanced state. Suppressing emotions. When you try to push down your emotions, the body's stress response might remain partially activated. It's like hitting the snooze button on your alarm. The threat, your emotions, might still feel present, keeping your body in a state of fight or flight. Chronic stress and consequences. Constant low-grade activation. Imagine the alarm system constantly buzzing faintly in the background. This is what chronic stress feels like on a cellular level when emotions are suppressed. This low-grade stress response can eventually lead to physical and mental health problems like high blood pressure, weakened immune system, anxiety, depression. Dr. Gabor Maté discussed someone who suppresses their anxiety before a big presentation. The body releases stress hormones to prepare for the perceived threat of the presentation. Suppressing the anxiety keeps the stress response partially activated, potentially leading to physical symptoms like a racing heart or sweaty palms. Perhaps he presented a situation where someone avoids expressing anger during a conflict. The body releases stress hormones in response to the conflict, but the anger remains bottled up. This can create tension and contribute to chronic stress in the long run. Overall, suppressing emotions can keep your body's stress response in a low-grade activated state, potentially leading to chronic stress and its associated health problems. By acknowledging and expressing emotions in a healthy way, you can help your body return to a balanced state and promote overall well-being.
Waited for him at home. Sidney would walk in, greeted by yet another dinner to eat and to enjoy. Never wanting to disappoint either woman in his life, Sidney kept eating 2 dinners a day for years until gradual weight gain began to raise suspicions. Okay? So that this poor man suffered under the belief that, number one, he was responsible how everybody else felt, and number two, he must never disappoint anybody. So he actually couldn't say to his mother, you know, Mom, I got amazing news. I got 4 kids. And I'm going to have dinner with them most of the time. Nor could he say to his wife, you know, Rosalind, I'm very close with my mom. She needs my support. So once or twice a week, I'm going to have dinner with her. He just tried to please everybody all the time. And this need to please everybody all the time, it'll kill you. And for reasons I will tell you. And these reasons are not psychological. They're physiological. They have to do with the body, the immune system, and everything else. You can't separate the mind from the body. And the problem with my profession, the medical profession, is that we make two separations that are actually, in life, impossible to make. One is that we separate the mind from the body. We think that people's emotional lives are somehow separate from their physiology. Completely false assumption, unscientific, refuted by all the research, and yet if you go to a doctor, I mean, I know some of you here have had autoimmune illnesses, for example. So ask yourself, when you've been to the physician with your rheumatoid arthritis, your joint being inflamed, or some other rheumatic condition, did anybody ever ask you about your childhood? Anybody ever ask you about your stresses in your life? Anybody ever ask you about your marriage? About how you relate to your work? About how you look after yourself or how you don't? Likely not. Likely what they did is they said, you got this illness, we don't know why you got it, and here are the pills.
Dr. Gabor Maté likely used the story of Sydney and his mother to illustrate the concept of unconscious, self-destructive behavior that can be rooted in unresolved emotional issues. Here's a breakdown of the story and its connection to Dr. Gabor Maté's point. Surface-level picture. Sydney appears to be a devoted son who prioritizes his relationship with his mother. He maintains a daily dinner tradition with her, even after marriage and having children of his own. Underlying issue, Dr. Gabor Maté might suggest that Sydney's behavior, while seemingly positive, is actually self-destructive. Here's why. Neglecting family. He prioritizes his mother's needs over his wife and children who wait for him at home. This creates an imbalance within his own family. Emotional avoidance. Eating 2 dinners daily might be a way of avoiding uncomfortable emotions. Perhaps he struggles to set boundaries with his mother or feels guilty about neglecting his own family. Unhealthy coping mechanism. Food becomes a way of managing these emotions, leading to weight gain. Self-destructive but unconscious. Dr. Gabor Maté's point is that Sydney's behavior, while motivated by a desire to maintain a close bond with his mother, is ultimately harmful to himself and his family. Key aspects of self-destructive behavior in this case. Unconscious. Sydney likely doesn't realize the negative consequences of his actions. Non-necessary. Self-perpetuating. The behavior, eating 2 dinners, might initially provide comfort or avoid conflict, but it eventually leads to weight gain, which could further complicate his life. Unresolved emotional issues like difficulty setting boundaries or unresolved grief can manifest in self-destructive behaviors that appear positive on the surface. Chronic stress from emotional avoidance can contribute to unhealthy coping mechanisms, potentially impacting physical health. What Sydney could do. Self-awareness. Recognize the emotional roots behind his behavior. Why does he struggle to set boundaries with his mother? Is there unresolved grief after her death? Open communication. Talk to his wife and children about the situation. Healthy coping mechanisms. Find healthier ways to manage difficult emotions, like exercise, journaling, or therapy. Setting boundaries. Practice setting healthy boundaries with his mother, ensuring his own family's needs are also met. Dr. Gabor Maté likely used Sydney's story to highlight how seemingly positive behaviors can be rooted in unresolved emotional issues and ultimately be self-destructive. By promoting self-awareness and healthy coping mechanisms, individuals can break free from such patterns and build healthier relationships.
So they'll give you a medication to suppress the inflammation, or they'll give you a medication because autoimmune disease, the immune system attacks the body itself, so we give you a medication to suppress the immune system itself, or we'll give you cortisol or some kind of other steroid. Well, that's all we do. We don't talk about the life factors that may have contributed to the onset of the illness. So they'll give you a medication to suppress the inflammation, or they'll give you a medication because autoimmune disease, the immune system attacks the body itself, so we give you a medication to suppress the immune system itself, or we'll give you cortisol or some kind of other steroid. Well, that's all we do. We don't talk about the life factors that may have contributed to the onset of the illness. And I can guarantee you that any of you here who've had chronic illness of any kind, you're going to recognize yourself in this talk completely and 100%. And you're going to wonder, why didn't anybody say this to me before? Because in the West, when I say the West, I mean the dominant Western culture, unlike Aboriginal cultures, unlike the traditional medicines of China or India or native traditions around the world, we separate the mind from the body. So we treat only the body, unless you have mental illness, in which case we still separate the mind from the body. And the other thing we separate is the individual from the environment. As I said to you last night, those of you that were there, you can't separate people from their environment. People are shaped by the environment. And in lifelong interaction with the environment is how human beings live. Now let me give you 3 examples of that. Why you can't separate people from the environment. It's been shown now, for example, that children whose parents are stressed are much more likely to have asthma. Now, not controversial. Several studies have shown that. So in polluted areas where there is more asthma, it's the kids of parents who are stressed who are most likely to have the asthma.
Dr. Gabor Maté mentioned this fact about children of stressed parents being more likely to have asthma for a few reasons. Mind-body connection. He emphasizes the mind-body connection, suggesting chronic stress in parents can have a negative impact on their children's health, even manifesting as physical illnesses like asthma. Stress and the immune system. Chronic stress can weaken the immune system, making children more susceptible to allergies and asthma. Here's a possible explanation. Stress hormones like cortisol can suppress the immune system's ability to fight off allergens and infections. Chronic stress might also lead to inflammation in the body, which can contribute to asthma symptoms. Parental stress and behavior. Highly stressed parents might be less likely to take their children to regular checkups or be aware of early asthma symptoms. Additionally, stress in the home environment can create a sense of insecurity in children, potentially contributing to asthma development. Highlighting a gap in medical knowledge. Dr. Gabor Maté is pointing out that traditional medicine often overlooks the mind-body connection and focuses primarily on physical causes for diseases like asthma. Dr. Gabor Maté encouraged viewers to consider the potential impact of stress on their children's health and seek additional resources if needed. Here are some additional points to consider. The research on the link between parental stress and childhood asthma is ongoing, and the exact mechanisms are still being investigated. Correlation doesn't equal causation. While stress might be a risk factor, there are likely other factors, genetics, environment, that contribute to asthma development. Dr. Gabor Maté isn't suggesting that stress solely causes asthma, but that it might be a contributing factor, especially in polluted areas where children are already at higher risk. Dr. Gabor Maté's point is that chronic stress in parents can potentially impact a child's health, including their susceptibility to asthma. He highlights a potential gap in medical knowledge and encourages viewers to consider the mind-body connection in understanding health issues.
Now, most doctors have never heard about that. And if they did, they can't explain it. And yet it's so obvious, you see. Those of you that have asthma, anybody had asthma here before in your life? Okay. You were given 2 kinds of inhalers if you had asthma. One inhaler is probably called Ventolin, and its job is to open up the airways, because what happens in asthma is you get a spasm of the muscles that surround the airways, so you get this narrowing of the tube through which air has to pass into the lungs, so you're wheezing and whistling and laboring your breathing. And the other inhaler you got would have been a steroid to suppress the inflammation, the swelling, and the inflammatory debris that clutters up the airway. So you get 2 inhalers. One is called a bronchodilator to dilate, open up the airway. The other is to suppress the inflammation. Now, what are these inhalers based on? The inhaler that opens up the airway is a copy of adrenaline. And the inhaler that opens up, that suppresses the inflammation is a copy of cortisol. Serve us, what are adrenaline and cortisol? They're stress hormones. Exactly. In other words, we're giving asthmatics stress hormones, the same stress hormones that are made by their own adrenal glands when they're stressed. All that's happened is that their own stress response mechanisms have been exhausted, and now we have to give them stress hormones from the outside. Now guess what? If you have rheumatoid arthritis or lupus, what will they give you? Cortisol, the stress hormone. Shouldn't we be asking ourselves that if we're treating people with stress hormones, whether or not there might be a connection between stress and their disease? Now, of course, why the children of parents who are stressed? Because the parents' stresses actually program the physiology of the child. Because you can't separate the individual from the environment. And this is true all our lives. A study of women in Australia, 500 women, 550 women, who had lumps in their breasts that were of sufficient concern as to require a biopsy. Now, they had these biopsies, but before the results came back, they also had a psychological interview or questionnaire. It turns out after the results came back that if a woman had had a significant stressful incident in her life just prior to the onset of that lump, that by itself had zero effect on whether or not that lump was cancerous. Similarly, if a woman was emotionally isolated, that also had zero effect. But if a woman was emotionally isolated and had a major stressor, the risk of that lump being cancerous was 9 times as great as the average. Now, the medical doctors running the study couldn't understand this one either, because they said, how does 0 and 0 add up to 9? You see? Because we don't understand the connection between individuals and the environment. Now, here's the deal. If I were to act inappropriately towards you right now, if I were to stress you right now, physically or emotionally, you'd have 3 healthy options. But, well, no, let's see, I won't go into that right now. If I were to stress you right now, what would happen is that that stress wouldn't just be in your head, it would be in your whole body. You know, your heart rate would go up, your nervous system would be firing off all kinds of impulses, your adrenal glands would be pouring adrenaline and cortisol so that you could escape or fight back. These are the flight or fight hormones. And so your body would be in a different state physiologically in a split second in order to help you fight to escape. That's good. So in the short term, the stress hormones help you fight or to escape. But what do they do in the long term? In the long term, the stress hormones deplete your body, suppress your immune system, give you heart disease, high blood pressure, give you ulcers, thin your bones.
The scientific validity of Dr. Gabor Maté's claims about emotional isolation, stress, and cancer risk is a complex issue. Here's a breakdown of the evidence and some key points to consider: supporting evidence, stress, and the immune system. There's established research showing chronic stress can weaken the immune system. A weaker immune system might be less effective at fighting off infections and abnormal cells, potentially increasing cancer risk. Psychosocial factors and cancer. Studies suggest a link between psychosocial factors, stress, social support, and cancer progression and mortality. Emotional isolation can be a significant stressor. Limitations and considerations. Correlation versus causation. Studies often show correlations between stress and cancer, but they don't necessarily prove that stress directly causes cancer. Other factors like genetics and lifestyle choices also play a crucial role. Specificity of stress. The type, intensity, and duration of stress likely play a role. Dr. Gabor Maté mentions emotional isolation adding to the risk, suggesting specific stressors might have a stronger influence. Study design. The specific study Dr. Gabor Maté mentions might not be widely known or readily available for review. Evaluating the study's methodology and data analysis is important for assessing its validity. Overall, while there's ongoing research, there is evidence suggesting a link between chronic stress, emotional isolation, and potentially an increased risk of cancer. However, it's likely a complex interplay with other factors. More research is needed to fully understand the mechanisms at play. To validate Dr. Gabor's insights, according to National Cancer Institute, Psychosocial factors have been hypothesized to increase the risk of cancer. This study aims 1. To test whether psychosocial factors, depression, anxiety, recent loss events, subjective social support, relationship status, general distress, and neuroticism are associated with the incidence of any cancer, any, breast, lung, prostate, colorectal, smoking-related, and alcohol-related. 2. To test the interaction between psychosocial factors and factors related to cancer risk, smoking, alcohol use, weight, physical activity, sedentary behavior, sleep, age, sex, education, hormone replacement therapy, and menopausal status with regard to the incidence of cancer. And 3. To test the mediating role of health behaviors, smoking, alcohol use, weight, physical activity, sedentary behavior, and sleep, in the relationship between psychosocial factors and the incidence of cancer. Psychosocial factors such as depression, general distress, and low social support have long been theorized to increase cancer risk.
Okay. Now, what would happen if you were stressed, something happened that was stressful to you, and you're sitting there all upset about it, and your body is in a state of imbalance and upset, but somebody that you trust came along and said, "Hey friend, I see that you're not feeling well, I see that you're upset," puts a hand on your shoulder and says, "Hey, do you want to talk about it?" Now what would happen to your body right away? Yes, it would relax. You'd take a deep breath. Your brain would get oxygen. You'd start thinking more clearly. Your heart rate would slow down. Your blood pressure diminish. The stress hormones abate in your system. And you go back into a healthy balance. All because somebody said, "Hey buddy, do you want to talk about it?" Those women that had been stressed but were emotionally alone, the stress hormone acted on their system for months. That's why they were more likely to get cancer. It's really straightforward. In other words, again, the physiology of one individual can't be separated from the psychological and social environment. And finally, at the end of life, a study in a major medical journal a few years ago showed that amongst elderly couples, when one of them is hospitalized, what do you suppose happens to the other one? They get sick. In other words, the risk of illness goes up in the other one when the one is hospitalized. Why? Because our immune systems are not isolated from our psychological, emotional, social relationships. You can't separate the mind from the body, and you can't separate the individual from the environment. So how this works, I'll tell you in a few minutes, but I'll just illustrate it with a disease I'm quite interested in because, again, medical science says we don't know the cause of it, and I think that it's only because we're not looking. And I'm talking about a rare condition called ALS, amyotrophic lateral sclerosis, which is a degenerative condition of the nervous system that leaves you very rapidly completely paralyzed. Your mind is intact, but your body's paralyzed, and in the end you can't breathe, and you die of respiratory failure. And right now, there's a court case with somebody with ALS who wants the right to medical suicide. And you remember Sue Rodriguez in Victoria who went through the same thing, and her case was rejected in the Supreme Court. So it's a very dire disease, and it carries a terrible prognosis, and most people who get it are dead within a few years. And it strikes otherwise healthy people. So a woman came to me for a second opinion about 12 years ago now, actually referred to me by my friend Gordon Neufeld, a psychologist. And her story was that she'd been diagnosed with ALS by one of the leading experts in the condition in British Columbia, or in the world actually. But she didn't want to accept the diagnosis. She wanted me to tell her that it was only stress. Well, it was ALS, but it was also stress. Her story was that she was a teacher and a vice principal at an elementary school in lower mainland of BC, in Richmond. And she found at a certain point that she could no longer hold the pen in her hands because her fingers just wouldn't obey her brain's commands. she also began to experience difficulty walking. Now you would think if that occurred to you, you would very urgently seek a medical opinion. Not her. What she did is she'd get up for months. She would get up at 5:30 every morning, slowly get herself dressed, of course, because her fingers would have trouble buttoning or pulling zippers. She'd drive herself to school, walk into school at 7:30 with her troubled gait. She would clutch the chalk in her clenched fist and painstakingly scrawl the day's lesson on the board for the students. Teach the whole day, go home, stay up late at night to prepare the next day's lesson. Everything was slow for her, you see. And next morning, get up at 5:30. And she did that until she could no longer walk. Now, or barely. Now, is she alone in this? Not at all. Everybody I've ever looked at with ALS has got exactly the same personality and the same behavior pattern, without exception. Without any exception. Doesn't matter who I interviewed or read about. In writing this book, I also looked at the medical literature. And in 1970, there was a study at Yale University Medical School about ALS patients by two psychiatrists who wrote the following. These patients, they invariably evoked admiration and respect from all staff who came into contact with them. Characteristic was their attempt to avoid asking for help. Hard, steady work without recourse to help from others was pervasive. There seemed to have been habitual denial, suppression, or isolation of fear, anxiety, and sadness. So no expression of negative emotions, so-called. Some spoke gradually of their deterioration, or, sorry, casually, like it didn't matter, or did so with engaging smiles.
ALS, the disease the teacher couldn't face. In his talk, Dr. Gabor Maté discusses amyotrophic lateral sclerosis, ALS, a progressive neurodegenerative disease, in the context of a teacher's story. Here's a breakdown of ALS and its connection to Dr. Gabor Maté's message. What is ALS? ALS, also known as Lou Gehrig's disease, attacks nerve cells in the brain and spinal cord that control muscle movement. Over time, these nerve cells deteriorate, leading to progressive muscle weakness and atrophy. Symptoms typically start gradually, with increasing difficulty walking, talking, swallowing, and breathing. Unfortunately, there is no cure for ALS, and the disease eventually leads to paralysis and death, usually within 3 to 5 years of diagnosis. The teacher's story and the connection. Dr. Gabor Maté uses the story of the teacher to illustrate the potential dangers of ignoring symptoms. The teacher's initial struggles with writing and walking could be early signs of ALS. Denial and progression. The teacher's intense denial likely delayed seeking medical attention and potentially managing the disease's progression. A common pattern. Dr. Gabor Maté suggests that denial of ALS symptoms might be more common than we think. People might fear the diagnosis or feel obligated to push through symptoms, potentially worsening their condition. The importance of early diagnosis. While there's no cure for ALS, early diagnosis can help with managing symptoms and improving quality of life through physical therapy, medication, and assistive devices. Planning for the future, including making legal and financial decisions, participating in clinical trials that might offer new treatment options. By using the teacher's story, Dr. Gabor Maté emphasizes the importance of acknowledging and addressing health concerns, even if they're frightening. Early intervention and acceptance can be crucial in managing chronic illnesses like ALS. Additional points. The exact cause of ALS is unknown, although genetics and environmental factors might play a role. Active research is ongoing for potential treatments and a cure for ALS. Support groups and resources are available for people living with ALS and their families. Overall, Dr. Gabor Maté uses the story as a cautionary tale, highlighting the importance of acknowledging symptoms and seeking medical attention to manage ALS and other chronic conditions effectively.
To health, and he himself never missed a game until he could no longer walk. Now, this is typical with everybody with ALS. Now, are we blaming patients for causing their own illness? Well, no, we're not, because it's not deliberate. It's not deliberate. These are unconscious patterns. Let me give you an example from my personal life. So when I was 54 and my mother's 78, she was in a nursing home because she had a genetic illness called muscular dystrophy, and she could no longer walk, move her arms much. Mentally, of course, she was completely with it. She died at age 82. And by this time, she was a widow and she had to be in a nursing home. Now, one afternoon, I'm visiting her in a nursing home, and as I'm walking down the hall of the nursing home, I have a bit of a limp, just a slight limp. The reason I had a limp is because I had arthroscopic surgery that morning on one of my knees, a surgery which was minimally invasive, and they just cut out a piece of a torn cartilage, which I incurred because I used to jog on cement, and I didn't pay attention to the fact that it hurt jogging on cement. I missed a lecture in medical school about the relationship between pain and tissue damage, so that I didn't know this was a bad thing, so I continued to jog on cement, tore cartilage, surgery that morning, that afternoon, a bit of a limp. When I get to my mother's room, I open the door, and my limp disappears. And I walk into her room with a perfectly normal gait, greet her, we visit. I walk out again in a balanced way, and then I close the door behind me, and I start limping again. Now, what do you suppose I was doing?
Dr. Gabor Maté's story about his limp while visiting his mother in the hospital likely connects to his message about the mind-body connection and the potential for unconscious stress responses. Here's a breakdown of the possible connection. Dr. Gabor Maté mentions that he had surgery on his knee, but when he visits his mother in the hospital, his limp disappears while he's with her. The connection. Dr. Gabor Maté might be using this personal story to illustrate a few key points. Stress and physical manifestations. He might be suggesting that even though his conscious mind knows the pain is due to the surgery, physical cause, his subconscious mind perceives a stressful situation, visiting his possibly ill mother. This can trigger the body's stress response, potentially leading to a temporary alleviation of the physical symptom, the limp, as the body prioritizes dealing with the perceived threat. Unconscious protection. Dr. Gabor Maté might be suggesting that his limp disappears unconsciously because he doesn't want to burden his mother with his own pain. This highlights the potential for unconscious behaviors driven by emotions and the desire to protect loved ones. Mind-body connection. This story emphasizes the connection between the mind and body. Our thoughts, emotions, and experiences can have a significant impact on our physical state. By sharing this story, Dr. Gabor Maté might be encouraging his audience to consider how their own stress might be manifesting in their bodies, even in ways they might not be consciously aware of. He might also be promoting open communication with loved ones to avoid unintentional emotional burdens. There are other possible explanations for Dr. Gabor Maté's story, such as the possibility of pain medication or adrenaline masking the limp temporarily. The specific details of the story and Dr. Gabor Maté's full explanation in the video would provide a clearer picture of his intended message.
Anyone? Taking care of her, not wanting her to worry, yeah. But here's the thing about my mother. She was 78. She had survived the Second World War. She had survived the Nazi genocide, the death of her parents in Auschwitz. She survived communist dictatorship, the Hungarian Revolution in 1956, emigration to Canada with 2 adolescent boys and my father, the birth of a child in Canada when she was 39 in a new country, the whole immigration experience. Do you think she could have handled and she was a mentally and emotionally very strong person, do you think she could have handled the fact that her middle-aged son had a bit of a limp the afternoon of the arthroscopic surgery? Had I thought about it, I would not have suppressed my limp, but the point is I didn't think about it. It went back to my very first year of life. When I was 2 months old, when the German army marched into Budapest, and my mother phones the pediatrician to say, would you please come and see Gabor, because he's crying all the time, the day after the invasion. And the pediatrician says, of course I will come, but I should tell you, all my Jewish babies are crying. Now, what do you think that was about? What did I, as a 2-month-old, know about Nazis or Hitler or genocide? What was I reacting to?
Stress.
The stress of my mother. Infants pick up on the stress of their mothers. And the infant learns very quickly that if the mother is so stressed already, that if I add more stress to it, that might threaten my relationship with her, because she'll be even more unhappy. Then the infant will learn to suppress their own pain, simply to maintain their relationship. Now, that's not a mother's desire ever to give that message to an infant, but we do automatically and unconsciously. That's just how it works. And that becomes the memory, and I'll talk to you more about those memories later, but it becomes a memory without recall. I don't recall that time in my life, but the memory is in my body. And my friend Servas, who works with bodies a lot, he sees the body memories in the way people stand, or they hold themselves, or the way they walk. And we hold these memories in our bodies, and we're not even aware of them up here because there's no conscious recollection. So that suppression of my limb was a body memory of what I had to do to maintain my relationship with my mother. Now, the woman with ALS, the teacher, she was an adopted child. And shortly after the adoption, guess what? Her mother gets pregnant. And the biological child was the mother's center of attention. And the adopted child, from an early age on, learned, or at least perceived, that she wasn't loved and accepted and celebrated like the biological child was, and hence she worked to make herself lovable. And how do you work to make yourself lovable? By suppressing your own feelings, by always being nice, by always taking care, and always ignoring your own needs.
Dr. Gabor Maté used his personal story to illustrate the importance of early attachment. Strong emotional bonds with caregivers in early infancy are crucial for healthy emotional development. The impact of neglect. Feelings of abandonment, even in infancy, can have a lasting impact on a person's emotional well-being. Scientific considerations. Neonatal perception. Newborns can perceive and respond to their environment. They can distinguish their caregiver's voice and scent and show distress when separated. Early memories. While explicit memories from infancy are unlikely, implicit memories, emotional associations, might be formed and influence later behavior. However, there are limitations. Accuracy of memories. Memories, especially from such a young age, can be reconstructed or influenced by later experiences. Individual differences. The impact of early experiences varies depending on the child's temperament, genetics, and later relationships. Dr. Gabor Maté's interpretation. He might believe his crying as an infant was a response to feeling neglected or insecurely attached. Alternative explanations. There could have been other reasons for his crying, such as hunger, discomfort, or illness. While the specific details of Dr. Gabor Maté's experience are subjective, his point about the importance of early attachment is supported by scientific research. Early experiences can shape emotional development, and strong caregiver bonds are crucial for healthy emotional well-being. Additional notes. Dr. Gabor Maté might not be suggesting that his crying experience as an infant is the sole cause of any challenges he might have faced later in life. The focus might be on highlighting the potential impact of early experiences and the importance of nurturing caregiver-child relationships.
And it was purely unconscious. This is her coping patterns since she was a small child. She did not do it deliberately. And Lou Gehrig's father was an alcoholic. And if any of you grew up in homes where there's alcoholism, you know how it works. Is that the children, or one of the children, becomes the caregiver to the parents, emotionally or even physically sometimes. And that then becomes your personality. That then becomes how you live your life, because you think that's who you are. Because how we are as kids, we think that's who we are. That's not who we are, but that's what we come to believe, and that's how we behave then. And that's what creates these patterns. So there's nobody here to be blamed here. Nobody here to be blamed. It's just how it works. Now, why do these patterns translate into illness? That's because, as traditional medicine has always understood, and as Western science has now confirmed, mind and body are inseparable. So if you look at the important systems in the body and the brain, they're completely connected. So that the emotional centers in the brain are connected to the immune system and the hormonal apparatus and the nervous system. Now the emotional centers in your brain have one major role to play, to keep you alive. Now, what is the biggest need of the newborn? Emotionally speaking, and even physically speaking, is attachment to the adults. Without that attachment, we don't survive. You can see that. This is true, of course, of baby birds and baby mammals, but especially of human beings, because we're the most underdeveloped and the least mature and the most helpless for the longest period of time of any creature on Earth. And I'll say much more about that in my talk on ADHD. Now, that means that our brains are wired for attachment. We're wired to attach. Big centers in our brains are dedicated to maintaining our attachment relationships. That's our biggest need. Those emotional centers in the brain are connected with the nervous system because the nervous system warns us when our attachment needs are not being met, and then we cry. And then we get stressed. That's the immune, that's the hormonal apparatus. And all that has an impact on our immunity. Because it turns out that all these systems, the hormonal apparatus, the immune system, nervous system, and the emotional centers in the brain are connected by the nervous system into one giant electrical grid. Fibers of the nervous system connect them all together. So that anything that happens in one aspect of that system happens in the other aspects. So they're connected. So that electrical fibers or nervous fibers from the brain go to the spleen where the red cells are stored, or to the bone marrow where they're manufactured, or to the thymus gland in the neck where immune cells mature.
Our body is like a giant communication network. Just like how a cable connects your TV, phone, and computer, nerves in our body connect everything from our brain to our heart, immune system, and even the places where our immune cells are made. These nerves constantly send messages back and forth, like electrical signals. This means what happens in your mind can affect your body. For example, feeling stressed can send signals that make your heart beat faster or weaken your immune system, making you more likely to get sick. In short, your thoughts, feelings, and body are all connected. Everything in your body talks to each other using a special network, nervous system. Your thoughts and feelings, emotions, can affect your body's physical health, immunity, heart rate. It's all connected. This communication happens 24/7. Your brain constantly receives information from your body and sends instructions back. For example, if you get a splinter in your finger, sensory information, your brain receives the signal via nerves and tells your hand to pull it out, motor response. This is a simplified explanation, but it captures the essence of Dr. Gabor Maté's message. The nervous system plays a crucial role in coordinating all the different systems in our body, creating a complex and interconnected network that influences both our physical and mental well-being.
And back up to the brain. So there's a constant neurological communication that's going on in our systems, 24/7, every second, every millisecond. That's one form of connection. The other connection is by means of chemical messengers that each of these systems secrete into the circulation, which then travel to the other organs, so that the brain reads what's happening in the body, and the body reads what's happening in the brain. So it turns out that the immune cells in our circulation can manufacture every hormone that the brain can manufacture. So the immune cells in your circulation are talking to the brain and listening to the brain. That's the second connection. The third connection is the brain-gut connection. So let me ask you this question, and I'll ask for a show of hands. If you've had the following experience, please just put your hand up. That is, that you had a powerful gut feeling about something, and you ignored it, and you were sorry afterwards. Okay, if you've had that experience, put your hand up. Okay, just about everybody here. Now, why is it that the gut is so much brighter than the brain is? Not the brain, but the mind. Than the intellect, I should say. It's very simple. Because the gut is connected to the brain, in fact, the gut sends many more connections to the brain than vice versa. When the gut receives messages from the brain, it reads them and it magnifies them and sends them back up to the brain. So the gut feelings tell you the whole picture. Your thoughts only tell you a small part of the picture. So people who had a stroke in the part of the brain where language is processed, these are called aphasiacs. They're much better able to tell when somebody's lying than the average person who can understand speech. Why do you suppose? Since they don't understand the words, what are they paying attention to? They got feelings, which read the body language of the person, the facial expression, the congruity of the mouth and the eyes. Is it really, when the person is smiling, is it just a mouth how smiling? Have you seen the parliamentary debate on CBC? And when the politicians stand up and they smile, they're grinning here, there's nothing up here. It makes you uncomfortable to look at it. Anybody with gut feelings would turn the TV off. Now, there's another large group of people, another large group of human beings who read gut feelings accurately and respond to them. And what do we call those people? Children. Small children. Young babies don't listen to words, they don't even understand them. But they react unerringly and intuitively to gut feelings. Now guess what? When you put your hand up and told me that you've had strong gut feelings that you've ignored and you were sorry afterwards because you believed your intellect rather than your guts, you told me the story of your childhood. And the story of your childhood is that you were born with the gut feelings intact and connected completely. But at some point something happened to you. At some point you got the message that in order to survive and to be acceptable, you have to suppress your gut feelings. Because here's how it works. Children have two needs. Infants, anybody, any human being. We have two basic needs. And the more immature we are, the more important the first need becomes. And that's for attachment. And attachment means that connection with another human being for the purpose of being taken care of. That's an absolute need of the small child. Can't live without it. Impossible. So that's one large need. Another need, however, we have to function as full human beings is to be authentic. Authentic means that we know who we are, what we feel, are able to express it, and able to honor it in our behavior. So we have the need for attachment, and we have the need for authenticity. So far, so good. But what happens if in order to attach, we have to suppress our authenticity?
Gut feelings are those intuitive hunches we experience as a feeling in the gut. They can be positive premonitions or a sense of unease about a situation. How we experience them. Gut feelings often arise quickly, without conscious reasoning. They might manifest as physical sensations like butterflies in your stomach or a tightness in your chest. These sensations are likely linked to the complex communication between our gut and brain. Scientific research. The gut-brain connection is a growing area of research. Our gut microbiome, gut bacteria, is linked to the production of neurotransmitters, brain chemicals, that influence mood and emotions. Studies suggest the gut might send signals to the brain through the nervous system, potentially influencing our feelings and decision-making. Chronic stress and gut feelings. Chronic stress can disrupt the gut microbiome, potentially affecting the gut-brain communication. This disruption might contribute to weaker gut feelings or difficulty trusting our intuition. Gut feelings are a fascinating example of the mind-body connection. While the exact mechanisms are still being explored, science suggests a link between our gut and brain that influences our intuition. Chronic stress can potentially disrupt this system, making it harder to trust our gut. Gut feelings shouldn't replace logical thinking. Consider them alongside reason and evidence when making decisions. Taking care of your gut health with a balanced diet and stress management might improve your gut feelings. By understanding gut feelings and the gut-brain connection, we can make more informed decisions and prioritize our overall well-being. Gut feelings and authenticity are intertwined in the sense that they both play a role in how we make choices that are true to ourselves. Imagine you're offered a high-paying job that seems prestigious but requires long hours and clashes with your values. Your gut feeling might give you a sense of unease, butterflies in your stomach, a sign that the job might not be truly fulfilling. Ignoring this feeling to pursue the money could lead to inauthenticity and long-term unhappiness. Overall, gut feelings can be a powerful tool for living authentically. By listening to our intuition and trusting our inner voice, we can make choices that align with our true selves and promote a sense of well-being.
Because our parents can't handle who we are. Because they can't handle our anger as 2-year-olds. Because they can't handle our expression of our needs. Because they're too stressed. They're too needy. Like my mother was in that terrible situation. Then we suppress who we are. We suppress our authenticity. And we suppress our awareness of our gut feelings because the expression of them would bring us into conflict with our caregivers and threaten our attachments. And so our problem as adults is that a lot of our behaviors are still coming out of our need to attach. So we're still behaving like little kids who need to attach and need to be liked and need to be accepted and approved of at the expense of our authenticity. And that, people, is what makes us sick. Now, a fourth connection I didn't even know about, but has been described since I wrote my book, is the heart-brain connection. It turns out that the heart itself has a nervous system. In the pericardium, which is the fibrous membrane that surrounds the heart, there's a network of nerves which have predictive capacities. So when people say, especially for negative things, so when you say, oh, I knew it in my heart, you did. And that brain in the heart is connected to the brain up here. So that's yet another kind of connection. So then naturally, whatever happens emotionally and how we live our lives has a huge impact on our physiology because these systems are not separate, they're just one system. So let's look at the question of how the repression of anger then might suppress our immune system, okay? So I'll ask for a volunteer here, and whoever volunteers, I can promise you two things. One is that you might feel uncomfortable for a minute, and the other is that you learn something about yourself, okay? So, any volunteers? You know, thanks, right there. You don't have to do it, just stay where you are. Here, what's your name? Lorraine. Lorraine? Well, thanks for volunteering. Here are the rules, okay? This is a metaphor or a representation of your life. You sitting in that chair. Therefore, you can't leave the chair, okay? So whatever happens, you're going to have to stay exactly where you are. Other than that, you can do whatever you need to. You got it? Okay. So, Lorraine, what I'm going to ask you is, if you're okay with me standing right here as I give the lecture. Is this comfortable for you? Okay. So, I'm going to come closer now and ask you if it's still okay. If I give the lecture here, is that still okay with you? Yes. It's fine. No. What about if I stood right here and gave the rest of the lecture right here? How would that be for you?
It would be a little uncomfortable.
It's uncomfortable. So what would you like to do about it?
For you to step back.
You'd like me to step back and, okay, how are you going to get that?
Asking you.
You're going to ask me, okay. You can ask and I'm going to say heck with you and come a bit closer, okay?
Push you away.
No, okay, now you'd push me away. Now you'd push me away, right? You'd push me away.
Yes.
Okay, very good. As you were pushing, what emotion do you think you'd be generating?
My guts were just going like this and I was feeling really smothered.
That's why you pushed me away, but as you were pushing, what do you think you'd be feeling?
I felt.
Not what you felt, but what you would feel if you were actually pushing me. What's the emotion do you think that'd be there for you?
I think that would be like, I don't know, a little bit of anger and a little bit of...
Exactly. Anger. And that's a healthy anger. Now, healthy anger is nothing but a defense of your boundaries. And basically, Lorraine, what you'd be saying to me is, you're in my space, get out. You're in my space, get out. Now, if you said that in the first place, you would need to be pushing me, right? But the pushing itself, it's good. It's a good response. It's a healthy response. So, in other words, healthy anger is an expression of a boundary defense. So the job of our emotions. Now, by the way, if I was somebody else in your life, I mean somebody that, you know, we had a different relationship with, you might welcome them coming close to you, right? No, I don't mean me. I mean your child or your partner or whoever, or you know, somebody. You might actually embrace them, right, in a different situation. So the role of emotions, basically, is to respond to, approach, and welcome the healthy and positive approach, and to keep out the unhealthy and aggressive one. So it's either I want more of this or I want less of this. So that's the job of healthy anger. That's the job of the emotions. In other words, it's to let in what's healthy and nourishing and to keep out what's dangerous and unwelcome. That's the job of emotions, basically.
To illustrate Dr. Gabor Maté's point on repression and healthy anger, focusing on a different health outcome, the case of John. John was a successful businessman known for his calm demeanor and ability to navigate complex deals. He prided himself on his rationality and rarely expressed anger. However, beneath the surface, John simmered with unspoken resentments. Childhood experiences. Growing up, John's parents were highly critical. Any display of anger was met with punishment, leading him to believe anger was a sign of weakness, repressed feelings. John learned to bury his anger deep down. He became the peacemaker in arguments, swallowing his frustrations for the sake of maintaining harmony, the downward spiral. Over time, John's repressed anger began to manifest in unhealthy ways. Physical symptoms. John started experiencing chronic headaches, high blood pressure, and digestive issues. These could be signs of stress-related illness caused by the constant emotional suppression. Autoimmune response. Dr. Gabor Maté suggests chronic anger repression can contribute to autoimmune diseases, where the immune system attacks the body's own tissues. John might be more susceptible to such a condition due to his emotional state. Strained relationships. John's inability to express healthy anger led to passive-aggressive behavior and/or resentment towards colleagues and loved ones. This created distance in his relationships. A turning point. One day, John suffered a heart attack. Facing his own mortality, he began to question his life choices. He realized his repressed anger was eating him alive, impacting both his physical and emotional well-being. The road to healing. John sought therapy to learn how to express healthy anger in a constructive way. He began to communicate his needs more assertively, set boundaries, and let go of past resentments. The positive change. As John embraced healthy anger expression, his physical symptoms started to improve, his relationships became more authentic, and he felt a newfound sense of inner peace. This story illustrates Dr. Gabor Maté's point. Repressing healthy anger can have a detrimental impact on our physical and emotional health. By learning to express anger constructively, we can improve our overall well-being and build healthier relationships. This is a fictional story, but reflects the potential consequences Dr. Gabor Maté discusses. The specific health impacts of repressed anger vary depending on individual factors. Therapy can be a valuable tool for learning healthy anger expression.
Now, what is the job of the immune system?
Fight off bacteria.
Yeah, so basically, the job of the immune system is to keep out what's unhealthy, like bacteria, or to kill cancer cells. That's what it does. Or to let in what's healthy, like vitamins and nourishments and so on. If your immune system attacked the particles of food and destroyed them before you had a chance to absorb them, you wouldn't live. So that the job of the immune system is like that. It's been called the floating brain because it has recognition capacity, reactive capacity, and learning capacity. So it's the same as the emotions. The immune system does the same thing as the emotions. protect us, and let in what we need. Given the unity of all these systems, it's obvious that when you suppress the one, you're suppressing the other. And that's why people that suppress anger, they have diminished activity of their immune system, as has been shown in studies. Or what happens is that the immune system gets so confused because our emotions are confused that it turns against ourselves. And that's when you get autoimmune disease, when the immune system actually attacks the body itself. Fundamentally what happens is, one way or the other, if you don't know how to say no when you need to, your body will say it for you in the form of illness. So chronic illness represents the body saying no when you didn't do it. Not your fault. This is how you were programmed before you had any choice in the matter. So again, it's not a question of blame or self-blame, but it does mean that to prevent illness, or if you have an illness, to deal with it more effectively, you need to learn to assert who you are and to say no. Now that might be difficult sometimes because the people in your life have got used to you as a yes. They've always heard you say yes. Some of them might not like you very much if you start saying no all of a sudden. And what you're going to do when you start saying no is you're going to find out who your friends are. Because the real ones are going to say to you, hey, I'm so glad you're finally saying no. And the ones that were simply there because you were constantly available for them are going to, oh, what happened to her or him? You know? That's it. But so it'll create some conflict which will trigger all your fears about attachment. So you're going to have to learn that you are more important than your attachments. That wasn't true when you were a kid, but it's true as an adult. I'm going to finish with one story and then we'll take questions and do a couple of little exercises for you. Gilda Radner, you might remember her as a comedian on Saturday Night Live. And she died of ovarian cancer. And I didn't know anything about her life, but I read her biography because I knew she died of cancer, and guess what? It's the same story over again. So Gilda Radner was a very unhappy child, and she was overweight as a child, and she was thin as an adult because she was bulimic. So all the time that she was a star, she was actually a bulimic. Typically, she didn't tell her mother. Her mother didn't know that she was bulimic until after she had died. Why? Because she was still protecting her mother. Just like I was with suppressing my limp. Her father died when she was 12, a loss she never overcame, and so what she did, she always got into relationships with men where she would suppress herself to fit the image that the man had of, that he wanted of her. And the only way she could feel close to her mother was to make her laugh. So guess what? She becomes a comedian. So many comedians, by the way, are very troubled people. And guess what? I have a son who wants to be a comedian. For good reason. And then she develops ovarian cancer. Even after her symptoms of ovarian cancer began to cause physical distress, including bowel blockage, Radner was more concerned with satisfying others than with her own needs. She sought and received advice from sundry sources. Her dilemma, she writes in her autobiography, suddenly I began to wonder how to please so many people. Do I take magnesium citrate? What about the coffee enema? Do I do both? Do I do the abdominal massage or the colonic? Do I tell the doctors about each other? East meets West in Gilda's body. Western medicine down my throat, Eastern medicine up my butt. When it seemed she had been successfully treated, Gilda became a poster girl for ovarian cancer, featured on the cover of Life magazine. She was an inspiration to many, but the recovery was short-lived. Still attached to roles she had developed as a child, she berated herself for having, quote, let down others by developing terminal illness. I had become a spokeswoman for the wellness community and a symbol of getting well. I had been a model cancer patient, completely active in my own therapy. Now I felt like a living example that didn't work. I'm just a fraud, I thought. Only close to her death did Gilda finally learn that she could not be mother to the world. I couldn't do everything I wanted to do. I couldn't keep calling all the cancer patients I knew. And I couldn't try to help all the women with ovarian cancer. And I couldn't read every letter I received because it was ripping me apart. I couldn't cry all those tears for everybody else. I had to take care of myself. It is important to realize that you have to take care of yourself because you can't take care of anybody else until you do. Well, the trouble is you can, but if you don't take care of yourself in the process, you're going to make yourself ill. So the issue, of course, is not that we shouldn't provide care to other people. I mean, caring for others and being kind, that's wired into us as human beings. That's a true expression of who we are.
Dr. Gabor Maté talks about a connection between stress and cancer, but it's important to understand the limitations of this theory. Here's a breakdown. What Dr. Gabor Maté suggests. Dr. Gabor Maté suggests chronic stress can contribute to cancer development through its impact on the immune system and hormonal changes. Stress and immune system. Chronic stress might weaken the immune system, making it less effective in identifying and destroying abnormal cells that could potentially become cancerous. Stress hormones. Chronic stress can lead to elevated levels of cortisol, stress hormone, which might influence cell growth and division. Scientific evidence. There's currently no conclusive evidence that chronic stress directly causes cancer. Research suggests a potential link, but it's complex and involves various factors like genetics, lifestyle choices, and overall health. Stress can weaken the immune system, but this doesn't necessarily translate to an increased risk of cancer. Important considerations. Genetics play a significant role in cancer development. Lifestyle factors like smoking, diet, and lack of exercise have a stronger established link to cancer risk. Managing stress is crucial for overall well-being, but it might not directly prevent cancer. While Dr. Gabor Maté raises an interesting perspective, the connection between stress and cancer remains a complex area of research. Here are some valid reasons to manage stress for your health, even though it might not directly prevent cancer. Reduced risk of chronic conditions. Chronic stress is linked to various health problems like heart disease and diabetes, which might indirectly influence cancer risk. Improved immune system function. Managing stress can potentially strengthen the immune system, making it more effective in general disease prevention. Enhanced quality of life. Chronic stress can significantly impact your mental and physical well-being. Managing stress promotes a better overall quality of life. Focus on a holistic approach. Focus on a healthy lifestyle that includes a balanced diet, regular exercise, and quality sleep. Manage stress through relaxation techniques like meditation or yoga. Seek professional help if you struggle with chronic stress. Remember, while stress management is crucial for overall health, there's no single factor that guarantees you won't get cancer. Consult a doctor for personalized guidance on cancer prevention and risk factors.
But going along with that, there's to be self-care. That means that you must demand support. If you're caring for others, you must demand support when you need it. You must be able to have a break. You must be able to ask for help when you need it. You must be able to express how you feel. You must take time for yourself. There must be times in your life which is just for you. So that we have to find ways, amidst the role of caregivers, to actually care for the person here. Because if we don't, the result is burnout and illness. So again, it's not a question of being selfish and unconcerned. That's not so good either for your health. But it's a question of being as kind to yourself as you are wanting to be to others. It's kind of the golden rule turned around, you know. Do unto you, not just do unto others what you would have them do to you, but also do unto yourself what you wish to do to others. Any questions on what I've said?
I have a question.
Yes, please.
When you were talking about how you you're trying to hide yourself,
Yeah.
and trying to pull back. Is that also a time that we tend to go to addictions too?
Well, addictions is something a bit different. Addiction happens when we're stressed and we need to soothe ourselves. So when we allow all the stress to wash over us and we don't keep the stress away, then we get overwhelmed. Then one way to deal with the stress is to become addicted. So that it's very interesting when you look at families with addictions, you also see a lot of illness in other members. So they just represent different coping styles. The addict soothes themselves through the addictive behavior. The person who doesn't go to addiction, they're going to go suppress themselves and develop illness instead. There was a question here, yeah.
Yeah, that's what I was going to ask you about. The person that has an addiction problem, like I've seen this in quite a bit of people, they quit using their alcohol.
Yeah.
And then afterwards they become really like, they've been sober for like over a year or something, then they become chronically ill. So.
Okay, you know what, let me give you the mic so that people can hear you. It's a good question. Thank you.
People with addictions, like maybe alcohol,
Yeah.
They've been using alcohol to help themselves to self-medicate, but
Yeah.
after that they stop using alcohol, and knowing that their mentally and emotionally development isn't to par, they become chronically ill. Like
Sure.
I've seen that in a lot of people that I've worked with.
Yeah. Yes, you would expect something like that because if you look at chronic illness, if you look at the childhood conditions that give rise to addiction, they also give rise to chronic illness. So these adverse childhood experiences that I mentioned last night, any of you not there last night? Okay, so there's a group of studies called the Adverse Childhood Experiences Studies. They look at children, or they look at adults, and if they had physical, sexual, emotional abuse, or death of a parent, or some other catastrophic event in their lives, the more of these events there were, the more likely they become to addicted as adults, and the more likely they have autoimmune disease or cancer. So when people stop soothing themselves with the alcohol, but they're not dealing with the stresses, then, as you say, they're not dealing with the emotional stuff, then the illness will show up. That would not be, not to mention that alcohol itself promotes certain kind of cancer.
The following strategy is what Dr. Gabor stresses on his talk. Stress management, reduces overwhelm. Constantly saying yes to everything can lead to feeling overloaded and overwhelmed. Saying no allows you to focus your energy on the things that truly matter, reducing stress levels. Improve sleep. Chronic stress can disrupt sleep patterns. By saying no to extra commitments, you give yourself time to relax and unwind, promoting better sleep quality. Boosts the immune system. Chronic stress weakens the immune system's ability to fight off illness. Saying no can help you manage stress and potentially strengthen your immune response. Mental health. Prevents burnout. Constantly exceeding your limits can lead to burnout, a state of emotional exhaustion and cynicism. Saying no helps you avoid feeling drained and allows you to maintain a healthy work-life balance. Enhances self-esteem. Learning to say no demonstrates self-respect and sets healthy boundaries. This can boost your self-esteem and sense of control. Reduces decision fatigue. Saying yes to everything can make it harder to make clear decisions. When you prioritize, saying no becomes easier, freeing up mental energy for important choices. Physical health. Promotes healthy habits. Saying no to unhealthy social pressures like overeating or neglecting exercise allows you to prioritize healthy habits that benefit your physical well-being. Improves time management. When you say no to additional commitments, you have more time for activities that promote physical health, such as exercise, cooking healthy meals, or getting enough sleep. Reduces risk of chronic conditions. Chronic stress is linked to various health problems like heart disease and diabetes. Saying no can help manage stress and potentially reduce the risk of these conditions. Overall, saying no is not selfish. It's an act of self-care. By setting boundaries and prioritizing your well-being, you can manage stress, improve your mental health, and promote your physical health. Here are some additional points to consider. Saying no doesn't have to be harsh. You can offer a polite explanation or suggest an alternative time approach. The more you practice saying no, the easier it becomes. Saying no empowers you to take control of your time and energy, leading to a healthier and happier life.
Other questions on what I've said? Yes. Okay, yeah, so I'll just get you folks with questions to speak into the mic, and that way everybody can hear you.
I was just curious, when you had mentioned about not limping going into your mother's room.
About what?
When you had mentioned about not limping going into your mother's room, you know, there's other theories about birth order.
Yeah.
And you're the oldest in the family. I mean, can you isolate things off?
I think birth order, you know, I've seen this chronic caregiver pattern. I've seen it at every birth order possible. It's not automatically a firstborn phenomena. I mean, sometimes it's the second child who becomes the good kid because, like with my two boys, with the first son, we had a lot of conflict because we weren't very adept parents. So the second son pulls in and suppresses themselves more as a way of, I don't want that hassle, I don't want all that conflict. So he becomes the peacemaker. And so it can happen at any point. So birth order does have an impact, but so many other factors play into it, so that I wouldn't isolate that one. And there's another question somewhere else?
I should be loud enough, actually.
Yeah, you are, yeah.
I was just wondering, you mentioned bulimia.
Yeah.
I was wondering, can you elaborate on that? Is it addiction? What is that?
Bulimia is a form of addiction. And it arises for the same reasons that addiction arises.
It's like a self-soothing.
What's that?
Is it self-soothing? What is it?
You know what it is? It's a buildup of tension and an urgent release. So that it's a way of actually self-created, it's a way of releasing tension. And there's that relief. So the addiction I define as any behavior that you crave that has a sense of relief associated with it, and which has negative consequences, and you don't give it up despite the negative consequences. That's what addiction is. Bulimia is an addiction. The best way to understand it is a form of addiction, and the causes of it go back to exactly the same factors that would underlie addiction. See, there's only one story. There's only one story. You treat kids well, they grow up to be healthy adults. You don't treat them well, they're going to act out their unwellness in a number of ways. And all the illnesses that we have, and all these diagnoses are just different forms of people manifesting early trauma and early distress. That's all. It's very
Dr.
simple.
Gabor Maté compares bulimia to addiction because he sees both as coping mechanisms for underlying emotional issues. Here's a breakdown of his perspective. Traditional view of bulimia. Bulimia is often seen as an eating disorder, characterized by cycles of binge eating, followed by purging, vomiting, laxatives, etc. Dr. Gabor Maté's perspective. Dr. Gabor Maté suggests bulimia, like addiction, serves as a way to numb or escape difficult emotions like anxiety, depression, shame, trauma. The purging behavior, while physically damaging, can offer a temporary sense of relief and control. Similarities between bulimia and addiction. Compulsive behavior. Both involve a repetitive compulsive behavior despite negative consequences. Seeking relief. Both bulimic eating and substance abuse can be attempts to escape emotional pain. Underlying issues. Both conditions might have their roots in unresolved emotional problems or past trauma. Criticisms of this view. Some argue Dr. Gabor Maté downplays the complex biological and psychological factors that contribute to bulimia, Not everyone with bulimia necessarily has underlying emotional issues. While Dr. Gabor Maté's perspective offers a valuable lens, it's important to consider all contributing factors to bulimia. Here are some additional points. Bulimia is a complex eating disorder with multiple contributing factors, including genetics, social influences, and psychological factors. Emotional issues can play a role, but they might not be the sole cause. Treatment for bulimia typically involves a combination of therapy, nutritional counseling, and sometimes medication. If you or someone you know struggles with bulimia, seeking professional help is crucial. Here are some resources for people struggling with bulimia.
Yes.
Just picking up on the question about bulimia, how do you see anorexia?
Anorexia is related.
Like, do you see that as being addictive, or is that more on the suppressive?
It's, well, let me just formulate it for you. Anorexia is an attempt to be in control of something. When you don't feel your life is in control, that's one way to be in control, because that's something nobody can control you with. So you're going to be totally in charge. It's an emotional, or it's an attempt to deal with severe emotional loss that leaves you completely helpless. But in this one area of your life, you're totally in charge. That's how I understand it. And invariably, it has to do with relationships with caregivers, particularly mothers. I don't blame mothers, because the mothers are just acting out what happened to them as kids. But these kids with anorexia, there's always issues. And, you know, I know that, like the singer Anne Murray, I think her daughter was an anorexic. And what I read about them, it is a self-suppression on the part of the daughter. I think there's a lot of anger there that's being suppressed in anorexia. And that anger is being taken out on the self. That's how I understand it. There was a hand somewhere else? Yes, please.
What do you think about the idea of somebody getting cancer if they've experienced repeated physical traumas that have been accidental? Like somebody who's had a series of accidents throughout their life that have been potentially life-threatening accidents, and then getting cancer at a very young age and dying from it 40 years later?
Well, first of all, I would say that nobody has a series of accidents accidentally.
Okay,
So that, for example, if you constantly get into accidents, I mean, statistically, it might happen sometimes, purely randomly, that, you know, you always happen to be where the lightning strikes. But, you know, overall, people that are accident prone, it doesn't come from the outside. There's something about them where they ignore risk, or they're unaware of their environment, or something. And that has to do with early defense mechanisms. I'll say more about that in my talk on ADHD. Which is to say that they're stressed. So it would not be unusual then for them to get cancer. But I don't think it's the physical injury directly that causes the cancer.
no.
I think it's more the stress. And even if I had a physical injury, you see, if you had a physical injury, that's not the stress. You know what the stress is? Well, let me ask you this question here. I mean, some of you may not, you know, some of you may wish to answer. If you don't, that's perfectly okay. But is anybody here willing to acknowledge, and you don't have to, there's no pressure here, that you were sexually abused as a child? If that's true for you, just put your hand up. Okay, very good. Thank you. At the very back, how old were you when that happened?
4.
4. And for how long?
About a year.
About a year. And in that year, who did you tell about it?
Nobody.
Nobody. Thank you. How old were you when it happened?
11.
11. And for how long did it go on?
Not very long.
A few weeks?
A few days even.
A few days, okay. In those few days, who did you tell about it?
Nobody.
Nobody, okay. That's what the stress is. Because stress is not just what happens to us, it's how we process it. What you should have had to have been able to do was to scream and yell as soon as anybody touched you the wrong way. That's what you should have been able to do too, is just to scream and run and ask for help. The fact that you didn't is not your fault. By the time you were 4 and by the time you were 11, you had already learned that you were alone in the world. And that there's nobody there to listen to you. So it's not that you made a mistake, you just simply did what any child would, which is to assess the situation unconsciously, and you already knew that nobody there was there to support you. And there, when there's no support there, then you can't express how you feel. It's that suppression of feeling and the non-expression of the stress response that actually creates the long-term chronic stress.
Dr. Gabor Maté suggests that long-term chronic stress often has its roots in unresolved emotional experiences, particularly from childhood. These experiences can shape how we perceive and respond to stress in adulthood. Here are some potential causes of chronic stress from Dr. Gabor Maté's perspective. Childhood trauma. Experiencing emotional neglect, abuse, or other traumatic events in childhood can leave emotional scars that contribute to chronic stress in later life. Unhealthy attachment styles. Insecure attachment styles formed in early relationships can lead to a sense of anxiety and difficulty feeling safe and secure, increasing stress vulnerability. Suppressed emotions. Learning to suppress emotions, like anger or sadness, can create a buildup of emotional tension that manifests as chronic stress. Breaking free from the cycle. Dr. Gabor Maté offers a path towards escaping the grip of chronic stress: awareness and self-compassion. The first step involves becoming aware of your stress triggers and how your body reacts to stress. This self-awareness allows for compassion towards yourself and your struggles. Processing underlying emotions. Therapy can help you explore and process the emotional roots of your chronic stress, addressing past trauma or unhealthy coping mechanisms. Building healthy habits. Prioritizing self-care through healthy sleep, balanced diet, and regular exercise promotes resilience and strengthens your ability to cope with stress. Mindfulness techniques. Practices like meditation and deep breathing can help manage stress in the moment by calming the nervous system and promoting relaxation. An example on how we related in our lives, like Mark the workaholic. Mark was the epitome of a driven professional. He thrived on deadlines, reveled in long hours, and rarely took breaks. This constant go-go-go mentality had brought him success, but at a cost. Mark suffered from chronic headaches, insomnia, and a constant sense of anxiety. A breaking point. One evening, while rushing to finish a presentation, Mark experienced a crippling panic attack. His heart pounded, his breath became shallow, and the room seemed to spin. This terrifying experience forced him to confront the reality of his chronic stress. Seeking help. Hesitantly, Mark sought therapy. Through therapy sessions, he began to connect the dots. He realized his constant need to achieve stemmed from childhood feelings of inadequacy and a fear of rejection. He had learned to suppress his emotions, particularly anger, but this suppression fueled his chronic stress. A new path. With his therapist's guidance, Mark embarked on a journey of self-discovery. He learned to express his emotions in a healthy way, setting boundaries at work and prioritizing self-care. He incorporated mindfulness practices into his routine and started prioritizing restful sleep and exercise. A life transformed. Gradually, Mark felt a shift. The constant tension in his shoulders eased, his sleep improved, and his anxiety lessened. He discovered that taking care of himself didn't diminish his abilities as a professional. Instead, it enhanced his focus and productivity. He learned to say no to unreasonable demands and started valuing his personal time. Mark's story illustrates Dr. Gabor Maté's approach to overcoming chronic stress. By addressing the underlying emotional roots, practicing self-care, and cultivating healthy coping mechanisms, You can break free from the cycle of chronic stress and live a more fulfilling life. This story is a fictional representation, but reflects the experiences of many individuals struggling with chronic stress. Therapy is a valuable tool for addressing the emotional roots of stress, but other approaches like mindfulness and self-care can also be beneficial. The path to overcoming chronic stress is individual, and what works for one person might not work for another. Remember, you don't have to live with chronic stress. Take control of your well-being and seek help if needed.
So even if somebody with chronic accidents, first of all, there's reasons why they had them in the first place. And in the second place, they may not have had the environment where they could actually talk about their feelings and be really listened to and understood. And that's what creates the long-term stress. So it's the suppression that's the issue here. This is how I would respond, without knowing anything about the particular case, but this would be a general answer to your question. Yes? Okay, now you have to really yell or come to the mic.
Two things, more of an observation. Do you have any suggestions when we work with individuals and we know that they have the tools to, because they use words like self-medication or they know what is wrong with them.
Yeah.
But they say, why bother?
Yeah.
You know, what are there any suggestions on how we can work with them? And
yeah. Yeah. Well, first of all, let me ask you a question, all of you. How many of you, just again ask with a show of hands, how many of you made New Year's resolutions this year? How many of you made New Year's resolutions? Can I see the hands? How many of you still kept them? Okay. How many of you know what it takes to have a really good life? I mean, in terms of nutrition and exercise and emotional balance and all that. How many of you know what it takes? How many of you are living it? Okay? So first of all, thank you. First of all, the person you're talking about is not that unique, are they? They're just like the rest of us. So what I would say to that person is, you know what? Listen to them. What are they saying to you? They're saying that they're discouraged. So just hear their, instead of talking them out of it, listen to them. Ah, you sound really discouraged. Wonder what that's about for you. You must feel really hopeless sometimes. You know what, even me, I know how to live a good life, but I don't do it. It's just very hard. Really listen to them. Make sure that they feel validated and understood by you. Then they can get past it. If you try to talk them out of it, you can't.
the second point,
And again, a bit louder, please.
the second point is I am on an immune suppressant drug right now. And I kind of think maybe it's time to change my field. But I mean, I used to be a yes person.
Yeah.
But I'm wondering, you know, when I had trauma about 5 years ago, some major trauma that happened in our family, is that, and then this past year is when I started getting this immune suppressant issue and ulcers on my leg. And is there a timeline when this finally starts to really affect your body, or, you know, like, 'cause I always talk to my staff about self-care, how important it is, and I've been doing that myself, learning to say, you know, no, I have to, you know, create these boundaries, because as I was wanting to help people, make them, and that made me feel better, but then I realized that I wasn't taking care of me.
Right.
But is there any suggestions on how to take back some of that, you know, and become more stronger with yourself so that you're not getting sick like I am, so I can get off these drugs that I have to take every day?
Well, let me tell you about a friend of mine who lives in Calgary. Her name is Shannon Duke. And Shannon is 48 years old now. And when she was 37, she was diagnosed with stage 4 breast cancer. Now, stage 4 meant that the cancer was already in her bones by the time it was diagnosed. At that time, she had 2 young children, aged 1 and 3, and married to a well-to-do businessman. She herself was a very high-functioning executive for Microsoft in Calgary. And then she's diagnosed. She had the perfect life, perfect marriage, perfect home, of course. And then she's diagnosed. And healthy, physically, you know, fit. Always ate well. And then she's diagnosed with stage 4 breast cancer. And she has a transformation. Now, She gets the best medical advice she can get anywhere in North America, and she traveled to New York and elsewhere. She got the best medical treatment, and with that she was given 1 year to live, because that's the prognosis. Stage 4, despite the medical treatment, chances are you'll be dead in 1 year. Now, a year ago in February, just a year ago now, Shannon traveled to the Napa Valley of California with some of her friends, and they celebrated her 10th year survival and her 47th birthday. And the transformation that she experienced was that when she was diagnosed and started paying attention, she realized that her life had not been her life, because she was sexually abused as a child. And her response to the abuse was, of course, as many children will experience, it can't be about the adults, it's about me. So if this terrible thing happened to me, I must be a very bad person. So I have to be very good to compensate. So the good daughter who doesn't talk about it, doesn't disturb the waters, the good employee, the good student, the good wife who doesn't talk about the husband's addiction issues, because that would again disturb the waters. And when she's diagnosed and she decides she wants to live, she says, the hell with all this perfection and goodness. And she confronts her family of origin about the abuse that she had endured, and she confronts her husband. And she starts living an authentic, and she leaves the job, by the way, which wasn't her. Wasn't really expressing who she was. Now, 11 years later, the cancer is still in her bones, but it's completely inactive. But she knows that if she wants to stay alive, she needs to stay authentic. So that I believe that many of these issues are reversible. I'm not promising a cure here to anybody, but Shannon really underwent a major self-journey. And she continues every day to work at it, and she practices her spiritual ways, which she ignored all those years, and she pays attention to herself, and she keeps clearing this stuff out, and she's the picture of health. Her and I give workshops together sometime. So that there's ways to get there, but it's a commitment. And of course, it might threaten the attachment relationships. So that's always your call.
I was curious about any correlation with the endocrine system, with a person that is either living with alcohol-related birth defects and trauma. So when we look at what you're presenting here about mind and body connection and the immune system, so you're speaking about a lot about the hormones. So my question is about if the endocrine system is not developed fully because of alcohol-related birth defects.
I don't know the answer. I don't know the effect of. I'm not expert enough to tell you if there's any correlation between alcohol effects and the hormonal apparatus, the endocrine system. I do know that there's a correlation between trauma and the endocrine system. That's what I've been talking about. But I don't know the specific answer about alcohol. It's a good question. I may need to look it up. Are you telling me it's finished, or do you have a question? 5 minutes. We got 5 minutes. Okay. Well, look, rather than take another question at the moment, let me just ask you to take a couple of minutes and answer the following question for yourself. In what area of your life are you not saying no? I'm talking about where there's a no that wants to be said, but you're not saying it. Those areas are usually work or personal relationships, okay? And I suggest you just talk to each other. Just tell each other at your table, or a partner. If you don't want to talk, write it. But have a conversation with yourself or somebody else at your table about where you're not saying no in your life. That would be a personal relationship or on your job, okay? Just have that conversation.
If you're on your own healing journey, remember you are not alone. There are resources available to help you reconnect with yourself and find peace. Consider exploring somatic therapy, joining a support group, or seeking guidance from a trauma-informed therapist. By taking these steps, you can begin to rewrite your own autobiography and heal from the wounds of the past. Trauma can leave a lasting impact, but it doesn't have to define us. As Dr. Gabor Maté suggests, healing is about understanding our experiences and developing compassion for ourselves. What resonated most with you from this talk? How can we better support those who have experienced trauma in their lives? Leave your thoughts in the comments below. Thank you for joining us.